I spent a lot of time studying the lymph system. I did, those of you know that Bruno Cicli supposedly teaches the best lymph stuff, and he does. What is his point of view about lymph? They're teaching all the ways to manipulate the lymph to drain it. I have very expensive machines that will drain the lymph system. They're called light beam generators. But the breakthrough for me was thinking about what's in the lymph. And when I started to get what's in it, this is going to apply to every single thing you do. Instead of treating the disease, I'm not treating blood pressure, and I'm not treating heart disease, and I'm not treating any disease. I'm treating the underlying matrix. I'm treating where all the stuff that isn't leaving the body is stuck. That's all I'm treating. Or the way I say it to lay people so that they get it is I'm treating the kink in the hose. And if you think of it that way, it's easy. So let's think of it that way for a minute. I have my garden hose, I'm out there, I'm going around a corner, it gets a little bent, the water doesn't come out, right? You go straighten the hose out, water comes spurting out. Well, the lymph system is this network of vessels that passes through the whole body, and it sits right next to the blood supply. And the lymph system has lots of little vessels. You think of the 600 to 900 lymph glands, right? We all know those, at least as practitioners we do. The swollen glands here, the swollen glands here, the breast lumps, the cystic ovaries, whatever. But what we forget is if you have 600 to 900 lymph glands, they're everywhere. What do I mean by everywhere? It's real simple. Think of the cold, the flu, the food poisoning, the hangover, or any time you just felt awful. And when you did, people always tell me, especially with food poisoning, they'll say, I ached everywhere. I ached behind my knees. I ache right here. Sometimes there's these little swellings in my earlobes. Well, I remember when I had chronic fatigue, mono, and my glands here were swollen all the time. That was part of my breakthrough when I'm thinking about this. I'm thinking about all the swelling that I had had everywhere in my body. And I'm thinking about that's all in a system. But I never was taught that that could be a primary cause. And now I know it's the primary cause. So I do Bruno Cicli's training, and they're talking about manipulating it. And they're talking about moving it out. And I said to the really good instructors, I said, so what's causing that? We don't know, but probably a pathogen. That's what they said. It was like a throwaway line. You know, that was after I already figured this out. I remember asking a woman, and she said, oh, it's probably a pathogen. And I'm like, well, why aren't you treating the pathogen? See, that's the problem with this approach from symptoms, is we're treating recurring problems. Recurring sinus infections, recurring yeast infections, recurring strep throats, ear infections. If the word recurring exists in your patient's vocabulary or yours, we never got rid of the original problem, right? I know that. I have people, and that's what's in their history. So we're taking a history down the road, and I'll tell you how to do that. But it's about the recurring nature. So when I think about the lymph system, I think about the sewer that never drained. And eventually it might become the heart disease. That's where the plaque would build up, right? I mean, I know it's in the vessels. But it should have been broken down before, and it would have gone through the sewer and never ended up in the vessels, right? And the diabetes, low blood sugar, high blood sugar, all that compromises the immune system, right? As soon as you compromise the immune system, once the immune system isn't working at the level that it could, and the white cells are not eating up all that waste, it's turning into something that's going to coagulate. And when I describe it to patients, since there's going to be people watching this that are not doctors, I have to remind people that there's three fluids: blood, lymph, and cerebral spinal fluid. We all know what blood looks like. Cerebral spinal fluid you'll never see, because if you saw that, that'd be the last thing you saw when your spinal cord was open. So every other fluid is lymph. When you urinate, when you cough, when you blow your nose, when you cry, when you sweat. If you sweated blood, you'd be really worried, wouldn't you? You blow your nose and there's blood, you're really worried. When you cough blood up, you're really worried. So all the other fluids are lymph. So lymph is trying to get rid of all that stuff. So we get rid of things through urination, through sweat. We get a little carbon dioxide off. But we're trying to get rid of all this waste all the time. And if that sewer backs up, if there's a kink in the hose, unfortunately in a human being, what backs up behind it is a problem. Now, why do I say it's a system and why can it be a problem? Because that whole system, standing fluid breeds pathogens, right? Everyone knows that? If you put water on your bedstand and leave it there overnight, does it taste the same in the morning? No. And would you leave water, I wouldn't, but would you leave water in like let's say a glass jar for 3 or 4 weeks and drink that water? I don't think so. Matter of fact, my cats never took an anatomy, physiology, or biochemistry class, and they will not drink water that sat in the bowl too long. They won't. They look at it, they're like, they'll eat dead mice. They will eat birds. They will eat insects. But when the water sits there and gets that little biofilm on it, my cats are like, what they do is they follow me upstairs, they walk in the bathroom and they sit in the tub, like, are you going to run the water? So I put the stopper in, I run the water, and they drink. And then I have to pull the stopper out because if I leave it there too long, they're not going to go back to it. They're just like, no, are you crazy? But they'll go eat a dead mouse that they killed, whatever. And I'm like, they know that biofilms are not good. And we all know that biofilms are really bad. So imagine what happens when you get a kink in the hose from bashing your arm, or from an infection, or a woman that's been pregnant and gets a mastitis, or you've had swollen glands here from strep throat, or you've had repeated bladder infections, you've had whatever you've had. You get backup. Standing fluid grows pathogens. Virus, bacteria, fungus, mold, parasite. And almost all the practitioners in this room and most practitioners I'm talking to knows that pathogens produce these chemicals, these toxins that cause inflammation. And I'm not making a big statement to say that most of medicine is now saying that inflammation is the cause of most disease. I think they're going back to the 80% and they're treating the symptoms, right? Because they're giving you anti-inflammatories. I'm like, what caused the inflammation? I just keep going back to the cause. Yes, you're right, inflammation's there. Yes, inflammation in the vessels, cardiovascular disease, I get that. Inflammation in the brain, neurological problems, I get that. Inflammation in any system, you know, it can be endocrine problems, it can be anywhere. But I keep coming back to, it's caused by only two things, because there's only two things in the lymphatic system. There's either a chemical, so that's easy to figure that out, or a pathogen. Here's how you know if it's 99% certain that it's a pathogen. If it changes dramatically your symptom, then it's got to be a pathogen, unless your exposure to chemicals is extreme and repeated. Now let me explain this so you understand it. I have a woman that works down in Bloomingdale's in Los Angeles, and she works in the jewelry counter, and it's right next to the cosmetic counter. And she's about my age, and when she has 3 days off, her respiratory system clears up. When she takes a week off, she's great. As soon as she's back there, she's starting to get respiratory things. She's always exposed to perfumes, chemicals. People that work in the cleaning industry, people that work doing nails, you know, doing nail polish, all like that. If you're exposed to chemicals on a regular basis and your symptoms go up or down based on exposure, that's pretty simple, right? But all of my chronically ill people and all of your chronically ill people know that they get reactive to chemicals because they come in and say, can't have bleach in my house. Oh my God, I smell bleach, I get a headache, right? Oh, can't use regular cleaning products. Nope, that messes me up. So they stop all of that, right? I mean, really, about 99% of the people I work with stop that stuff because they feel bad. Remember I told you? The body's going to tell you what strengthens it or weakens it. Chemicals make me feel bad. I get away from chemicals. I don't even go places where they are. You have patients like that, right? But then they have these symptoms that come and go and they're not exposed. And I'm like, why are they coming and going? And so this is where we're really headed to, is what causes these things to change? Well, infections or pathogens, whether it's going to be cardiovascular compromise or any of the issues, they get worse or better based on conditions. And that's what we're going to focus on, because if we can diminish those conditions, then you're going to cut down the ability for these pathogens to have more babies. Replication, if you want to use a fancy word. So it's real simple. When there's a kink in the hose and the fluid's standing, they're more likely to replicate. And all of you that are doing structural work, you're straightening things out, right? Chances are things will flow. How many of you notice that the people that exercise effectively without a lot of trauma, that's a big qualifier, they pump their lymph system, right? It's a little harder to get sick when you're pumping your lymph system. It's almost impossible. Matter of fact, most of my athletes that are not over-exercising, that are not traumatizing themselves in a violent contact sport, they don't get sick as much as the people that are sedentary. Well, here's the easy reason. 80% of your lymph pump is on the front toe hinge. It really is. So when you're moving this toe hinge up and down, when you're walking, when you're dancing, when you're on a treadmill, when you're riding a bike, you're mechanically pumping that stuff through you. That's making a lot of presumptions. That's presuming your spine is working well, your gait mechanism is turned on. That's presuming a lot of things. But it tends to be that the people that are physically active in a way that is not traumatic to their body, they keep that system pumping better than the people that are sedentary. Would people agree on that? Yeah. Matter of fact, have you noticed that some of the people that weren't able to do things, you get the mechanics to do better, they stop getting so sick, right? They get out of pain, their hips aren't hurting because you've adjusted them. You know, you've done some work on, iliotibial band or whatever, and now they can walk more, and it makes it easier. So Kevin's person is a good example. You know, if she had trouble getting out of a chair, you know that lymph system has got a lot of stasis. Suddenly she's riding a bike, she's pumping, mechanically moving that through, because remember, we don't have a heart to pump the lymph system, it's only done by movement. Well, let's go to the things that will make it worse. Since infections make it worse, what are the things that usually make the infections worse for most of us? You get an injury anywhere, and you have pain. That becomes a site for a potential infection. So all the injuries that we've ever had, you have a little bit of damaged or necrotic tissue, right? The problem is that's going to be a kink in the hose, and that's also going to be where pathogens like to go. Matter of fact, I think most of you have noticed that when people get injured, wherever they get injured, there's a weakness there. And what happens? When they roll the ankle in soccer at 6, they keep injuring that ankle, and they keep taping that ankle, and they keep treating that ankle, and you're treating it, and they're 20 and 30, and you're still treating that ankle. But maybe the ankle's they've done such a good job at taping it and doing all that. Now we know it moves up the body, right? So now it's the right knee, then it goes to the hip, then we compensate by overusing the other side, and now they come into the chiropractor and they're complaining about this side of their neck. And you're adjusting their neck over here because it does test weak. But you keep adjusting it and it keeps not getting better. Or it gets better but it won't hold. So that's what I'm trying to teach you is this old injury down here might be the primary. But they're not talking about it as the primary because they haven't thought about it in a long time. But as a rolfer, I'm looking at them like, wow, that ankle is just weird. And I'm looking at it, it's like they're turned out, and it looks like they're wearing their shoe funny. And I'm thinking, maybe this neck is coming from this ankle, right? And I'll teach you later on in the training how to palpate, how to test the lymphatics, and you'll probably find a whole lymphatic channel running right up through here that's compromised, which might lead to, later on in life, edema in their leg, right? But they forgot about the ankle. But right now they're in for the neck, and you're saying, well, I keep doing this and it isn't working. And I know that's sort of what Kevin was talking about. You know, people keep treating the same thing, the symptom, but the cause is ignored. So people are coming in with this repeated injury. They don't think that it's causing an infection because it may not test, they may not have a symptom that they see a doctor for an infection. But we know how to test this, and we can find that infection. and it may be sitting underneath it. And it may show up later as something else entirely different. It just could be a stress on the nervous system that takes down the immune system, and now other things pile on it. So here's how I describe it to lay people, because you have to have descriptions that they can understand. And since I don't watch football, I'm not going to say it exactly correct, but it's like this, I'm running down a field and I'm doing really well. I get a punt return, and the punter is the skinny guy. So the skinny guy runs faster than the big guys, and the skinny guy gets a hold of my jersey and just slows me down a little, right? And then the big guys can catch up to me, and they jump on. So I got this ankle that I've injured since age 6, and I've done it a bunch of times, and I tape it, and I do all this stuff, and now it's made my knee a little unstable, and a lot of little things that niggle away at my body. And now I end up getting swollen. I get my neck out, and now I get all these swollen glands up here. I got a pathogen that started around a weakened area. It weakened the whole system. Boom, it just keeps moving. It slows down my whole body, and things move through my body. So by the time I end up in the chiropractor's office, I remember when I was younger, I didn't think of myself as needing chiropractic care, but by the time I got through college, Dr. Jensen saw me. He was a chiropractor, and he said, he was a naturopath too, he said, you need your neck adjusted. And I'd never had my neck adjusted. I was like, why? Well, now I know that all the lymph comes up the front and the back and moves through here. And I had swollen glands here all the time, and I had headaches all the time. Well, the headaches, what could that come from? I didn't know. But I get adjusted, and it's like something feels better. I didn't know that all this other backup, this logjam of other stuff would keep putting my neck out. Nobody taught me that. Does that make sense? So the injury pattern causes this weakness that will allow us to keep coming back to the same problem. Now, there's another couple of factors that are important, and all of you know this, but I'm talking to a lot of people that don't know this. As our diets are bad, and we're eating more acidic foods, and we're eating things that grow pathogens, those pathogens replicate, have babies, grow very quickly. But the problem is we're in pain, and our energy is down. So what do I always want when I'm in pain and my energy is down? I'm going to want something sweet to get my energy up, right? I don't like coffee because then I get weird. So, but people want that. I'm tired, I'm in pain, it hurts. I just need some, and think about it. When we're starving, it's like you go out to the restaurant and you're really starving. I mean, and seriously, and since I don't drink just because I'm not interested in it, people are always doing the thing. They need their glass of wine, they need the bread, right? They need sugar. And if you're really starving, it's like if she doesn't put the bread down soon, if her arm goes in front of me, I'm going to take a bite out of it. Because we're just like little kids. We are. The little kids are playing at the pool, they're running around like crazy, and they won't take a break, and you now see them screaming and yelling and getting out of control, and we know their blood sugar is down. And what I used to do when I was around little kids like that is I would cut up an apple, and they'd be in the water, and I'd shove a slice of apple in their mouth. I would. And I'd say, you need to come out and get some food. I don't want to, I'm having too much fun, I'm having a great time, leave me alone. You shove a slice of apple in their mouth, and they're like, they want another one. And another one, or I'd use orange slices, something really sweet, right? But if it was sliced, they could taste the sugar faster. They would suddenly want that really bad, and they're out of the pool trying to eat as much food as possible because their blood sugar's down. It's no different with adults. We're just more sophisticated, we're not going to scream and cry. We may throw temper tantrums, but we're not going to scream and cry. So here we are out to the meal. It's been 5 or 6 hours. We've had a stressful day. And now we're really low blood sugar, and everything is hurting, right? Everything's hurting. So they have the glass of wine, they have the bread, and they feel better short term. Now they just crash their immune system. Now the pathogens grow again, right? So the poor diet is an addictive response to the fact that this is what I call the Feed Me Seymour syndrome, Little Shop of Horrors. We're eating for billions of bugs. That's what we're doing. We're eating for all these billions of bugs in our body that are growing like crazy, and it's saying, feed me Seymour, and we get low blood sugar. And we need to eat that, otherwise we're going to collapse. And then we feel better, so our cycles are like this. And we know what they are when the blood sugar is going up and down. But every time it goes down, the immune system crashes. And when the immune system crashes, the bugs grow like crazy. So now we're not getting a lot out of our food. Our immune system is working really hard. The inflammatory chemicals, cytokines, et cetera, interleukins, are growing, and that's why we're hurting everywhere. But we don't know that. So every time you're eating a poor diet, you're feeding the bugs. That's pretty simple. But if we also want to get this stuff out of us, the other thing we need to do is not eat the acidic foods and eat the other foods, but we also need to eat foods that are not just alkaline, but are hydrating. So I'm going to teach a little different way of eating where you don't have to be thinking a whole lot about, people are always asking me which foods are good foods, which are bad foods. You know, I don't really care whether they're organic or not because I want people to be eating food. Because if you tell them it's organic, only organic, and they don't have access to it, then they won't eat. And then you got a problem because their blood sugar goes down. So I'm going to say eat foods that have a lot of high moisture content to them. And that's not French onion soup. I know that that was soup, but it's really salty, so it's not really high moisture content. You have to be specific with people. But it's the fruits and the vegetables. They tend to be more alkaline. They tend to have more hydration, and here's the key point. If you hydrate the body well, the lymph fluid dilutes down, you urinate more, you have more fiber, you eliminate more, you have better bowel movements, you sweat more, and you get rid of the waste. So even if you can't get your patients to eat organic, don't make them wrong. Give them the option saying, okay, let's eat the foods that are high water content, fruits and vegetables. And more importantly, and this is another piece you have to add because if you don't, they'll eat lots of fruits and vegetables, but it's going to be fried or it's going to be lots of spices. So I say to people, if you're going to cook a food or prepare a food in a way that it dehydrates it or makes it really spicy and hot, then you're losing the hydration. Now the hydration component, I think the best book for those of you who are out there that are thinking about it is The Body's Many Cries for Water by Dr. Batmanji, which I love that book and I tell people to read it all the time. And he says, make sure and have a quart of water for every 50 pounds of body weight. Every 50 pounds of body weight. Most of our patients weigh more than 150 pounds. That means they need a gallon of water a day. How many of you drink a gallon of water a day? Because I don't think there's anyone here there may be a couple under 150. Yeah, I go one person, maybe another one. What I do, since some of you know me, is I carry this 40-ounce bottle, metal, since I try not to drink out of plastic, and I put electrolytes in it to make it even better, and I try and go through 3 of these a day minimum. That's 120 ounces. But I have to carry it, otherwise I'm not going to do it, right? And then when it's, I'm a third of the way through the day and I haven't even really done hardly any, I'm like, oops, because I need to remind myself, right? Like right now. Well, the reality is if I do that, then I do better. But if you need a quart for every 50 pounds of body weight, that's for a normal person. That's not a really active person. So when I take an hour Zumba class in the morning, I go through 40 ounces in 1 hour and I don't even urinate. I sweat it out, right? I'm like, uh-oh, I need extra because it's not, I'm pulling my supply down. So when you tell your people that they need more fluid, the more moisture-rich their diet is, the less they have to drink. But I still eat lots of fruits and vegetables, like a lot, and I still need a lot of moisture. And when I do that, and this is the key, because if you don't get them to do this, they won't flush their system, right? So you could be giving them all the right remedies, you could be doing all the right stuff you're doing, but do any of you have patients that drink maybe 1 or 2 glasses of water a day? Most of us? Yeah, right. I have people that all they have is coffee. And we're talking like 2, 3, 4, 5 cups a day. I have people that even say to me, I can't drink water. Do any of you have that? Everybody, right? I have people that tell me I can't drink water because it doesn't go down. And they mean it. And if you look at their tongues, you'll see that it's cracked or fissured. And I remind people that when you see the ground and it's all cracked, somebody's not watering it. So if you pour water on really dry ground, it runs off. It doesn't go down. So all of our patients have inflammation in their body from all the bugs. You look at their tongues, it's cracked. You look at their skin, it's dry. You look at the heels, they're cracked. They need lotion, moisture all the time. You take the women that use lip balm and lipstick and you say, can you cut that out for a day? No, I can't. My lips will crack. They'll hurt, right? People hear that? Yeah. So they're not hydrated enough, right? So they're putting it on outside, but it's not absorbing. And that's where we have to teach them that the bugs are raising their temperature, burning off the moisture that's coming into their body, and the tissue isn't absorbing the moisture. So we have to work with that. And there's some things you can do. I'll teach you how to do that so that when they do drink, it absorbs and it goes in their body, and then it'll start to flush the lymph system. Because I have some people that drink. Here's a problem that I think you might have come in contact with. How many of you have, especially women, that drink a lot of water and they say, I have to pee really quickly, right? Happens a lot. Current statistics, medical statistics, 24.9 million people in this country are incontinent. 25 million. Just found that statistic. There's only about $3 billion worth of Depends sold in this country. It depends on how bad you are, how much you use it, right? But what you notice, if you go to Costco, now they have these big pallets of Depends right near the checkout registers. They do. I don't know whether they have it up here, but they sure have it down in San Francisco. And now instead of just Depends for women, now they have boxers and briefs for men. That's a really nice thing to have to deal with, isn't it? Here's the weird thing. All the people that are incontinent are dehydrated. Yeah, you guys agree, right? So what is their worst nightmare? Drinking water, hydrating. Because then they're going to have to run and pee, right? That's their thing. And they won't make it sometimes. So they have to wear Depends. Now, if you were in an industry that wanted repeat business, I used to say that tampons were the best repeat business because use them, throw them away. Depends is even better. Really, it's better. Because once you're 50, 60, I've had people in their 30s that are incontinent. It doesn't, quote unquote, get better. Actually, I'll teach you how to make that better. But how many of you know people that have now, once they need them the rest of their life, right? A lot of women after they deliver, incontinent, from then on, messes up their whole life, doesn't it? Men, same kind of thing. Doesn't matter when they do it, they need it. So if you're figuring that 25 million people are incontinent and those people don't like to drink water because it's going to make them worse, now they're creating more problems. They're causing more stasis in their lymph system. More pathogens are going to grow. The pathogens are all going to end up trying to get out through the exit door, urinary tract, right? Now they're going to be acidic. They're going to abrade the urinary tract more, and now they're going to get more incontinent. So if we learn how to manage that alone, there's a huge market out there of people that really need our help. But it's sort of counterintuitive to them to say, you need to hydrate more, because they're going to be going, no, not me, right? Well, the interesting thing is that if you compare that to the other market that exists out there, it's the chronic pain market. Current statistics. There's something between 560 billion and 635 billion spent on pain management in the United States every year. Did you know it was that high? Yeah. Let's say, and those are probably the 20% that are not being helped, right? There's a lot of people that are being helped. So here's the deal. What if we could only do 1% of those? That's only $5 to $6 billion, right? Maybe we could do 10%. I'm proposing that if you learn how to manage the system of the lymph system, most of the pain goes away. There are people that have, if a pain is, and this is the one thing I teach in the pain seminar, if the pain is a 10 in pain, 24 hours a day, 7 days a week, unrelenting, unremitting pain, regardless of what you do, then you need MRI, CT, X-ray, you might need surgery. But the pain that fluctuates, we have someone here who had back pain and was on 6 Vicodin a day. Yeah. And how many Vicodin a day are you on now? None. Okay, good. And you're not overweight and you're an athlete and 6 Vicodin a day made you not so happy? Yeah, exactly. So when pain comes and goes, that's a lot of those people that we could help. So you have to think that if there's that much out there in pain management, they're not looking at the fact that, let's do one other statistic so I think you'll get it. There's a great documentary out there called Fed Up. Any of you have seen it? Okay. Current statistic is 2/3 of America are obese or overweight. They're expecting it to go to over 80%. And most of them are going to have diabetes. Almost all overweight, you're going to find severe lymphatic compromise because the fat gets stuck in the lymph system. When you're overweight, is it highly likely you're going to have pain somewhere? Low back, knees, somewhere? So I'll bet you if you start checking the overweight, obese people with the chronic pain, you're going to find a whole lot of congruence. And again, we know the lymph system's compromised in the overweight people. We know the lymph system's compromised in the obese people, or in the pain people. And all we're going to do is we're going to work with the same thing to bring it down. That's all we're going to do. So we've got to increase the hydration. We've got to get the high water content foods, and that's going to move the system. Is that pretty simple? Not even hard.